Hello and welcome back, everybody, to another episode of 8 Questions in 8 Minutes. This is a show where I ask specialists in the fields of nutrition and the medical field about questions that are clinically relevant to your practice. And today we have with us on the obesity front, Katie Chapmon. Katie currently is updating the bariatric surgery and pregnancy chapter in the third edition of the Academy of Nutrition and Dietetics Pocket Guide to Bariatric Surgery. Katie, welcome to our show.
Thanks for having me.
So our first question is, what are the primary considerations when developing a personalized weight management plan for patient in a clinical setting? Let's hear your take on this.
All right. Well, first I want to gather my data. So I do take a look at labs, medical conditions and considerations that we need to have in place. And then I think on the other side, it's actually the kind of like life and lifestyle. So getting to know your patient and what they are actually capable of, because we could make the most beautiful plan, but if there's not a capability, then that's where it's all going to fall down. So I want to know about their life and their rhythm and what that looks like and how motivated they are.
Moving to question number 2, how do you assess an individual's nutritional needs and lifestyle factors when creating a weight management program? So we're going to focus on these 2 aspects.
Absolutely. Yes, I'm going to look at labs. Absolutely. Yes. I want to look at labs, vitamins and minerals, what needs to be repleted. I also will oftentimes do a food record or have them perform a food record. My preference is 7 days because I want to see everything. I want to see weekends. I want to see during the week. I want to see if there's anything that comes up. And I'm looking at a rhythm within that. So part of the assessment part is not only just what are they getting in and what could fill in their nutritional needs or what may be lacking or need to be further supported because of their biochemical data. And then on the flip side, how does their life run? Do they work? Do they work outside the home? Like, what does that look like? And how can their lifestyle impact how they can get in their nutrition?
Let's move into our third question. Could you elaborate on the role of behavior modification techniques in support of long-term weight management goals for patients, which I think is a challenge for most of the dietitians?
I think that behavior is so key in all of this because that's what helps to keep someone going and continuing. And we know that consistency is key in all of this. So, where I can look at behavior kind of changes, I'm thinking through mindset and I'm thinking through what are they doing in terms of kind of reshuffling life to be able to support this. Are they what things come up as challenges? That's always insightful of, Katie, you told me to do this, or we decided on this together. And then this came up because of my family doesn't eat the same way that I do. And so all of that behavior aspect and where the kind of cognitive behavioral challenges come together, that's really part of what you want to lean into and notice that through their challenges and almost try to kind of rework that language. So oftentimes I think of thoughts equals feelings equals action. So we have a thought that changes into a feeling, and then that makes an action. And instead of a straight line through that, we want to start to have offshooting lines from that.
Let's move into our fourth question. What dietary approaches or nutrition plans do you commonly recommend for weight loss or weight management, and how do you tailor them to individual needs?
Oh gosh, That's a great question because, right, we have so many different nutritional interventions that we've heard of, we might have personal experience with, we might like, we might not like. I can say that I oftentimes take a look and approach as, obesity is an inflammatory disease and process.
True.
So I oftentimes will start the approach from an anti-inflammatory kind of brain or mindset.
Yeah.
And then from there, then also adding in the other components that may be best suited based upon biochemical data, lab work, lifestyle.
Great.
So, example, if someone is really into tracking and numbers and data, we might lean into that. And then I have other people that, like, as soon as you're like, okay, I want you to reach this number, they're like, oh, I'm overwhelmed. I'm out. And then you have to approach it a different way. So I can say, I don't have one best pick of like, this is the one that I always use. I think fit is important.
Okay. Let's move to our fifth question. How do you address emotional or psychological aspects that may impact a patient's ability to manage their weight effectively?
Sure. Yeah.
Couple of tips.
Right. Well, I think I want to make sure that I have a really safe and kind of grounded space for those emotional aspects to come up and appear. I also want to make sure or connect them with a therapist or psychoanalyst, someone who could really go deeper and unpack that. So a more appropriate health professional than myself. However, in that moment, I also do want to sit with them, acknowledge, and then use some techniques to just de-escalate or deregulate their nervous systems in that moment. So some things that I'll use for that might be focusing on breath or breath work, such as box breathing or triangle breathing. I might also just have them close their eyes and do just a kind of mindful, really like meditation or mindful kind of refocusing. So we can, again, come back into the moment and work together on next steps. And then the third one that I think to seem to kind of find effective in a deregulation moment is actually just kind of talking through it and backing up a little bit of that like thought, feeling, action for a moment. And then just more of, okay, all right, that was a moment, that was a step, that was, that's not the whole entire thing. And then moving forward.
So letting them connect with the problem, seeing it like in the moment that, yes, this is where we are. Yeah, that's a great one. Let's move into our sixth question. Can you discuss the importance of physical activity and exercise in conjunction with dietary changes for successful weight management? Any thoughts there?
Oh my gosh, physical activity is so important with this. Not only from the perspective of what we think of as, all right, body movement, burning more calories, muscle development, but we have all this foundation. We want to build that muscle development so we burn more at rest. That's kind of a quick one, but I also take a look at the stress relief components that also can impact weight too, that physical activity can help out with. And we want that plan to be multi-layered, not only to include our aerobic activity that will increase breath, kind of burn more at that moment, but we're also wanting to increase muscle and increase muscle building so that we burn more at rest and also build muscle underneath as they're losing weight. And then third part is absolutely that kind of like that flexibility or even that resistance within there. So wanting to make sure that we look at the whole health of the person and that exercise and that movement helps to support from a weight perspective, but I also mood, stress, other sleep, other factors that actually can affect weight as well.
Lovely. Let's move into our seventh question. How do you handle challenges patients face during their weight management journey? And what strategies do you employ to keep them motivated, especially during their plateaus?
Okay. Ooh, yes. So
Hard one.
I know you're hitting me with the tough questions here.
In 8 minutes.
In 8 minutes.
Yes.
So,
Let's hear your thoughts.
so I think a couple of factors I look into. Well, one, I just get back to the basics. I definitely have my checklist that I'm checking into, not only nutritionally, physical activity, mood, but I also look at the other factors too. Sleep, stress. Is there any sort of genetic components? Is there any sort of gut health or microbiome components? Things that would naturally come up to the surface when thinking about weight or weight management. So I do want to check in if I'm missing any pieces or we're missing any pieces that could be a big key factor in a plateau. The other flip side of this is potentially we've been doing the same thing for quite some time, and we do need to shake some things up a little bit. Whether that is, oh, do I temporarily kind of lower some calories, increase some protein, move some things around that shifts it a little bit? Do I need to focus more on inflammation from a whole? Do I need to change up or encourage a change up in a workout or how that looks like? So some things are looking at that just consistency and timeline, and then not forgetting about the other aspects and the outside pieces. Someone may be like, oh, I'm getting in every single thing, but that also stresses them out. And then they stay up later to work and then they don't sleep, but they're getting all the things in. So that can be a double-edged sword sometimes.
Great. Let's move into our last 8 question. Are there specific tools, resources, technologies you frequently utilize to assist patients in managing their weight effectively?
I do sometimes. I'm always looking at this one as a fit. So as I mentioned before, some people are really data driven, and so I might use a food record system, and some people are electronic, some people are pen and paper. I want to find that fit of what's going to be most effective. So I do think the tool of food logging can be helpful to really see something on paper. So I will utilize that a bit. And then I think my other part is also, just exercising and having some sort of connection. So if I have a kind of group, kind of community or incubator that can oftentimes help people feel not so alone, that sometimes is helpful or effective too. This one's tough because I'm always individualizing. So I don't have a top fit of this is the thing I have everyone do.
Yeah.
But I do different technologies. Yeah.
You use those tools for data collection more than actually, and monitoring probably more than actually using it for any intervention, correct?
I do. And then I have oftentimes, especially when it comes to like food record, if I've had someone who has been on a weight loss journey with me for some time, and let's say they say like, quote unquote, oh, I fell off the wagon. I just didn't, like stuff didn't happen. I sometimes will go, you know what, let's go back like to food logging for a week so we can re-get a really good picture of this. And oftentimes that's motivating for someone to really go, oh, okay, yep, I'm seeing where I'm off. And it helps to kind of just visualize it a little bit more.
Lovely. Great. Very condensed information, which could or was delivered in a 3-hour training in details, much more. Thank you for being with us, Katie. Thank you all for watching our episode on weight management challenges, and hope to see your comments below. Until we see you again in another episode, please take care and see you soon. Thank you very much.
Thank you.